Good form, good function, great health. This project with UPMC Enterprises redesigns a traditional radiologist workstation to address ergonomic issues which cause chronic pain. UPMC Enterprises sponsors this project as part of their ongoing work to find innovative solutions to healthcare issues. UPMC Enterprises is located in Bakery Square. Radiologists at UPMC spend their workdays in reading rooms where they sit at a workstation and evaluate scans from the hospital network. The workstation is typically composed of 4 monitors, a computer mouse, and a dictaphone. Due to the existing workstation setup, radiologists experience significant pain in the neck, back, and wrist. Over time, the strain takes a toll on the body in the form of chronic pain and potential injury. The objective of this project is to address the source of radiologists' chronic pain. The project will redesign the radiology reading room workstation in order to address ergonomic concerns. The purpose of this redesign is to eliminate the potential for long-term injury by creating a workstation which puts the body in neutral position. A rapid upper limb assessment or rule analysis was conducted during these observations to quantify how far the body deviates from neutral position. Additionally, interviews with radiologists as well as a literature review and exploration of work standards were conducted. There were no process or equipment standards found for radiologists.
Based on observations done at UPMC locations, it was seen that after hours of work, many radiologists begin to lean forward and hunch over, as is shown. Additionally, many radiologists lean back and slouch in their chairs, causing them to need to look up at the screen, thus straining the neck. Observations showed wrist and forearm discomfort from constant mouse use, as well as from holding the dictation tool up constantly.
From each of the observations, the rule of scores were averaged across each of the 9 categories. In this assessment, a safe score would be 0. From the rule analysis, all portions of the upper body are out of neutral position. The upper arm, wrist, and trunk are particularly poor in the rule assessment, which suggests that the solutions should address these areas first in order to result in the most significant improvement. From the observations, the following main points were identified and traced back to their root cause. First, the major areas of pain are the neck, forearm, and back. These areas had the most hazardous rule scores and were also noted by radiologists during interviews as particularly painful. The tasks associated with these pains were traced mainly to using the mouse and dictating. From these actions, the key equipment and tools causing ergonomic issues are the mouse, keyboard, dictaphone, and monitor. To address back and trunk pain, we suggest a standing desk, which puts the spine in a neutral position and allows the user to customize the height. Additionally, an ergonomically sound chair should be used so radiologists are supported when they are sitting. To address neck pain, we suggest addressing the posture. Radiologists should position their body and their monitors so that they are looking at the center of the screen at no more than a 15-degree angle. The high-definition monitor should be placed in the center to avoid twisting. Additionally, a document holder should be provided so that radiologists do not have to bend to read.
In this video, the subject begins sitting with poor posture. In order to achieve proper posture, the adjustable desk is lowered so that the monitor is no more than 15 degrees below eye level. Additionally, the subject moves back in her seat so that she is at a 90-degree angle. She moves her chair forward so that her elbow is in line with her shoulder while using the mouse. As mentioned, the standing desk will help to put the spine in neutral posture. The elbow should remain in line with the shoulder, and the screen height should remain no more than 15 degrees below eye level. All of these recommendations will help to reduce trunk, back, and neck fatigue.
To address forearm and wrist pain, we suggest a hands-free microphone, which leaves the radiologist hands-free and in neutral position. To address eye strain, we suggest a backlit keyboard, as well as computer glasses, which will help cancel out blue light from extended staring at the screen.
By providing a headset, the arms will be freed as shown, and the strain caused by holding the dictating tool will be removed, thus removing any wrist pain associated with this tool. With all of these solutions combined, the final comprehensive total is slightly over $1,000 per workstation. Considering the average radiologist's salary of about $300,000, we feel this cost is reasonable, especially since many radiologists work extensively for the same hospital. This investment will lead to less pain and fatigue, which will increase the lifetime of a radiologist's work and increase productivity and quality of care. If these solutions were to be implemented, the rule of scores indicate that the body is much closer to neutral position. The overall rule of score is now within an acceptable range, which means that radiologists can work under these conditions without significant harm to the body. The risk score is still high, considering that the position of the mouse still elevates the risk. However, the other rule of scores for the arm and trunk are lower. Overall, the solution creates a workstation where radiologists can work safely for an extended period of time. This will create better health, better form, and better care overall.